So want to acknowledge the Lakwatak Weewakai Weewakam people, the wonderful community I work within, including our Indigenous colleagues and clients. I have no disclosures. Using drugs is the only thing that makes homelessness tolerable. This was the answer I got from a client of mine in my addictions clinic when I asked what his goals were for reducing his substance use. And I have to say that it resonated with me pretty deeply, and it still does. I immediately felt anger at the government, and I thought, why aren't you making sufficient housing available? I was frustrated because I didn't have a fix that I could offer to that client who was sitting right in front of me for that hopelessness that I heard. And it really held up a mirror to my own privilege. Just a few months prior, my husband and I had we purchased our first home, and so the disparity, how do I reconcile within myself the disparity of that? Another client said to me, if you're telling me that at the end of detox and treatment, I'm going to end up back on the street, why would I do that if there's no housing on the other side? So again, I'm left angry at this system. I'm at a loss for how to fix my client's issue, and I'm mired in this moral distress. But then it gets worse. This is Gillian Horton, physician from Ontario. Offer a burnout healthcare worker a baked good, and muffin rage may follow. And I think we all know what that feeling is, right? The popsicles that came through here so you don't burn out, and oh, we're going to do some yoga. But I got people to see. I got patients who need meds. I'm 45 minutes behind. I need to document all of the things that have to, how do I? It's just not reasonable. I believe the intent is right there. I think systems don't know what to do. So I want to give you some practical strategies to address those. So I think we need a reframe of how we approach the work that we do with people who use drugs. And if you have not read the book Compassionomics by Mazzarelli and Tresiak, it's a great book. It really demonstrates the evidence that shows that healthcare outcomes improve when we practice from a place of compassion. There is neuroscience literature that supports what many of us already experience, that exposure to others' pain can actually be painful for us. But taking action to alleviate another's suffering is a rewarding and positive experience. In other words, empathy hurts, but compassion heals. And the benefits of that are for the receiver as well as the giver of the compassion. I know from my own experience that when I'm doing good work, when I feel like I'm empowered to do good work, helping our clients to meet their goals or achieving some goal in some of our advocacy work, that I feel filled up by that. So that's what I'm aiming to do in my work. Practicing compassion is the action we can take to guard ourselves against burnout. So let's look at how we can address systems level strategies, client-focused interventions, and self-care buffer against burnout and compassion fatigue on all of these levels. So on a system level, I often remind myself, government groups, health authorities, medical boards, these are all very large and cumbersome entities. The actions that we can take that enact compassion involve using their own systems to affect the change. So the better we get to know the organization or the system we're operating within, the better we can utilize their systems to affect change. We need to seek out like-minded colleagues, some unlikely compatriots, some strange bedfellows, some shit disturbers, some other people who you can align yourself with. And I often think, don't always necessarily look for the people who are going to, be sitting right beside you. Look at the person who's across the room who might not be as invested and see, what do they bring to the table? What perspective might they bring? Maybe it's a contrary view, but maybe it's helpful to explore that to move your message forward. Collect data, apply for grants, use those systems, find ways to hold a mirror up to those organizations where the change needs to happen in ways that they can't ignore. And remember that as workers and activists, we will always be more nimble than these large organizations will be. That's where our power is, and we just have to do it in a smart way. On an individual level, what can we do for the client who's right in front of me in order to extend that compassion? Obviously being present, truly listening, demonstrating respect, showing up with humanity. This is unconditional positive human regard. It's like, I'm a human being. I'm here with another human being. How can I be present with you? How can I help support your goals? How can I listen? How can I be transparent in terms of what I am and am not able to do? One of the ways that I do this is I'll say to patients, you're the captain, I'm the navigator and the safety officer. So I want us to figure out our way to your goal, but there's also some parameters and some limits on what I'm able to offer. I want them to tell me what's important to them today. And the notes that I might have from our appointment yesterday or last week or last month might have changed because of the immediacy of their lives, which frequently changes their health goals. I have to remind myself that everyone has the right to make choices that others would consider unwise. We all have that right. Our clients have that right as well. I'm always very straight with my patients, well, as straight as I can be. Thank you. But I will say my recommendation is this: as your family doctor, this is, I think, the path. But if that's the path that we're going to go, I'm always going to talk about what the navigational and safety issues are. I'm a social worker. Social workers in the room? Thank you. Thank you. Clay Graybeal, this is his strengths-based social work framework called ROPES, which I love. It comes out 2001. So he talks about when we're talking with clients and even looking at our own stuff in our own lives, what are the available personal and community resources, exploring currently available and perhaps untried options, thinking creatively about future possibilities, considering what's going on when the problem is not occurring, and ultimately generating ideas that move a client closer towards solutions. This was part of my grad research. This is how I work. And so I love this tool, and just this little framework is frequently what I turn to when we're feeling stuck around options. Because, as I say to clients, sometimes we're stuck between a rock, a hard place, and a concrete wall because there's no housing, because there's all these limits. So let's try and figure out solutions in a more creative way. As helpers and supporters of people who use drugs, we need to understand our own role and our own subjectivity and how that plays a part. I had this former clinical supervisor, this lovely older queer social worker from the South with this lovely Southern drawl, and he taught me when I'm working with clients to imagine a protective porous membrane. I want you to start imagining this for yourself. This is the membrane that comes up to me when I'm working with clients. So maybe imagine in front of yourself a friend or a colleague, somebody that you work with frequently. And I imagine this membrane is situated like there between me and my client. It's there to remind me that I'm there in a provider role, that I'm there in a helper role. And it keeps me in that professional provider space that I can lean forward into it. And if I start to feel that membrane sort of smack my head, then I realize I might be leaning in too far and I might lose some of my objectivity in order to be able to support this person. So it's a bit of a reminder. It's also a bit of a splatter catcher, because sometimes when we work with the clients that we work with, there's vicarious trauma. And so it also provides a little bit of a protection against that. So mine is this slate blue gray color. It can be any color. Mine's got some bubbles in it. Yours can be anything that you want. So I want you to just take a moment and imagine that. So I'm like looking at Alana right now and I'm seeing it there, right? And it's something that I utilize as a tool in my clinical practice and use that as a tool that if that's useful for you. So we are all superheroes in this room. Put up your hand if you're a superhero, doing great work. Excellent. All right, I'm going to convert the rest of you as well. We each bring a unique combination of skills and personality to the work that we do. For myself, I see this Venn diagram, and it's the doctor, the social worker, the queer person, and they make this unicorn horn. Because I'm a unicorn, like many of us, that's the emblem on my chest. So we're all superheroes. We've all got an emblem on our chest. We're all wearing some sexy spandex number, colors of your choosing. It looks great. There's a cape. All right, so what do superheroes do? So I want you to imagine you're a superhero. So what are the superpowers? So mine is bringing all of that skills and experience together. You all have your own skills and experience that you're bringing. So think about what some of those are. Think about what some of those pieces might be that you might put on an emblem. You don't need to figure this all out today. You might figure this out later. Come and tell me about it. So what do superheroes do? Superheroes stand with a big chest, right? So maybe sit forward on your chair a little bit and just imagine, like puff up your chest a little bit, right? You've got all these superhero powers. Puff up, take a nice deep breath in. Feel stronger, right? This is embodiment. Superheroes, they put their hands on the backs of their hips. This broadens the chest even more. You can do this right now too. Put your hands on the back of there. Now imagine you've got a cape behind you. Oh wait, you can't have a cape floating behind you if you're sitting. You're just going to need to use that power and stand up. Stand up for me, please. Stand up. All right, chest up. Hands on the backs of your hips. Take a nice deep breath in. Imagine you're wearing this sexy spandex number. You've got a cape that is flowing in the wind behind you. And I tell you, this is an embodiment exercise that helps in some of those tough moments. And if you do it on a certain day at a certain time, you might actually find yourself start to fly. Thank you very much for your time.